It's a familiar commercial featuring actor Danny Glover as he raises awareness about a brain disorder that causes uncontrollable laughing and crying. But a recent CNN investigative report says a drug used to alleviate those symptoms is being abused in nursing homes.
Clinical nurse specialist Alice Benjamin is here to tell us more about why and how the drug Nuedexta is harming elderly patients. Good morning to you.
Good morning.
So those of us, many of us seen that commercial. What is Nuedexta and why is it prescribed for the brain disorder known as PBA?
So Nuedexta is a combination drug. There's two active components in there that synergistically work to help control neurotransmitters in our brain that lead to our emotion center. So it helps us control our laughing and our crying. Now with Nuedexta, what happens is with the medication, it works on the PBA, right? So PBA happens when there's an underlying neurological disorder. So it could be from ALS, multiple sclerosis, or even dementia or Alzheimer's. So there's something happening to the neurological system where signals aren't transmitting properly. So Nuedexta helps to regulate the neurotransmitters to make sure that our emotions are appropriate. So with PBA, people will often have frequent, uncontrolled, and sometimes inappropriate laughing or crying at different times. So for example, if we were at a funeral and everyone was crying, someone with PBA, they may start to laugh inappropriately and uncontrollably, but it's secondary to a neurological condition. So it's not a behavioral or emotional disorder.
I see. But I guess it's ending up in nursing homes and being prescribed. Is it inappropriately in those situations?
Well, yeah, so in clinical trials, Nuedexta, only 14% of the population studied were elderly. So we really don't know how this medication affects elderly patients. And many of the contraindications for Nuedexta, such as heart disease, certain electrolyte imbalances, or being on certain medications, those are contraindications which many of our elderly patients have. And so it's finding its way in nursing homes because there are a lot of neurological disorders in nursing homes. Patients are chronically ill. They have depression, they have Alzheimer's, they have these conditions. And so to manage those behaviors, some doctors are actually prescribing this medication off-label because Nuedexta was actually designed for PBA in patients with ALS or multiple sclerosis. So if to give the medication in someone who doesn't have those conditions, but maybe has dementia or some other traumatic brain injury, but still has PBA, it's considered off-label.
I see, because that's not what it was intended for.
Absolutely.
So what are the findings of the report about how it's linked to injuries and deaths?
Okay, so there was a CNN investigative report, and they looked at over 80 cases in about 19 states since 2013, and they were finding that Nuedexta was being inappropriately prescribed. Those are the allegations. And because it wasn't studied in elderlies during the clinical trial, we didn't realize or know that it would have all of these side effects. So because of how the medication works in the body, it can cause hypotension, cardiac dysrhythmias, other electrolyte imbalances, and these things can make someone syncopal, dizzy, and fall and injure themselves, or even worse, cause cardiac dysrhythmias that can lead to sudden cardiac arrest or even death.
Oh my goodness.
Yes.
You say that there's a fine line that's being blurred by the physicians and the drug makers. What do you mean by that?
So doctors and drug makers, we need to work synergistically, right? We all have our role when it comes to healthcare, but there is a fine line. So it's important that they communicate as far as what the medications are for, what the side effects are for, so we can make medication improvements, make it safer for our patients. However, when a provider, a doctor, becomes a paid spokesperson for the company, that can raise some issues and concerns about the integrity. And it's very important that healthcare providers remain objective and clinical when they're making the decision whether to prescribe this or not, and making sure that they have a watchful eye, because although this may be a new drug and there's nothing else on the market, we still have to consider the benefits versus the risk. And with Nuedexta, a lot of these elderly patients who are getting it, they actually have the contraindications to begin with. So it really falls on the doctor to make that good, solid clinical decision on if it's right for their patient or not.
Yeah, and speaking of that, for those watching that maybe have a loved one in a nursing home, they should first of all find out if their loved one is getting this medication, and how can consumers protect themselves?
Right, so the company that makes Nuedexta is based in California, so a lot of this investigative report was done in Southern California. If you have a family member in a nursing home, you want to know, are they on this medication? You want to know what other medications that they're on. Are they taking them? Have there been any dose changes? And has my loved one exhibited any new side effects or symptoms? Because that's going to be important to know. And even when you talk to your healthcare provider about those things, it's not a one and done. There needs to be a watchful eye and to continue monitoring this. So it's very important to continue that conversation, not only with just your doctor, but a pharmacist, because the pharmacist probably is more so the expert when it comes to the interaction of medications. Like I said, these elderly patients, a lot of them are on cardiac medications, which interferes with this medication. So we don't want these things happening to patients. And then also, as a consumer, if you have any questions about medications, foods, or any devices that you're on, you can go to the FDA. They have a website, fda.gov MedWatch. /MedWatch, and you can input your device, medication, or food and find out, have there been any reports or any concerns, what's happening in other places, and then as well, if you're experiencing a new symptom because of a medication, you can report that, and that'll help the greater good and companies get better with medications.
Yeah.
Very important information about, and we want to pass along information about clinical nurse specialist Alice Benjamin. Follow her on social media and check out her website, asknursealice.com.
Thanks so much.
Thank you so much.